And we're live. Ladies and gentlemen, welcome to the World of Gray podcast. In a society divided by black and white arguments, we are here to help you explore the world of gray. I am Kelowna's Cougar Meat Kid Colin Cutler. I'm by myself. So yeah, today we are going to discuss the coronavirus known as COVID-19. Now, I was very hesitant to do this at all for several reasons. One, and I put this in the YouTube title, I am nowhere near an expert in this. Not that I'm an expert in anything I talk about here, but I think it's really important. Sorry, work text now. I think it's really important to preface that I am definitely not an expert in this, and the things I'm going to read today are from articles and some are from the World Health Organization, but I have checked the media bias on the articles that aren't like World Health Organization or government websites, but still take them with a grain of salt because I think there's a lot of unknowns with this. So yeah, I think there's just a lot of unknowns with this, so we need to be careful of what we believe, but here we go. We're going to kind of split this into sections. So I want to start, first of all, what is COVID-19? The coronavirus has several different viruses in that family. So SARS is somewhat in this family. And COVID-19 is I want to say that I didn't write down, so I apologize for that. I wasn't going to do like a what is COVID-19, but I think it's the seventh type of coronavirus that they found. Somebody wants to fact check me while we do this, you can. And it is different than the SARS virus. Again, I'm not an expert, so you can Google that yourself. And the comparisons I'm going to do are actually about the flu and perceived death rates so far, which are still unclear. So I'm not going to do like a SARS COVID comparison, but from what I've read, SARS, which was very similar as a respiratory condition, had symptoms a lot faster than COVID-19, so it's easier to contain, but that's not really what we're going to get into. So if anyone has some comments before we get going, let me know, and we will discuss that before I start reading some of this stuff out. Bueller, now's your time. Okay, so we're going to start with some positive here because I think that's really important with the amount of panic that's going on right now. So this is an article from, I think it's called The Conversation. Yeah, theconversation.com, which my mother posted this because she's being very optimistic about this whole thing, and I'm a cynical man, and I am not being the most positive person about all of this. So she posted this, and I just made sure I double checked the credibility of the website, and it does seem to be a highly credible website. It is from a not-for-profit educational information website. So yeah. So this article is 10 reasons why you ought not to panic. This is about the coronavirus. I'm going to bullet point some of these, and then others I'm just going to read out. Also, if you're watching on the watch party, that I can still read while I read the article. So if you want to chime in on something, I'll still see that. As I go through this, I will try to go back to the World of Gray page periodically to see what people are saying. But I'm only one person. No, Hardy's barking outside. He's not barking to get in here. Carrie. Hello, Carrie. Carrie's saying the puppy wants in, but he doesn't. He just wants to bark at people. Okay, so this article, Sherry has joined us. Hello. 10 reasons you ought not to panic. So the first one is we know what it is. So this is basically saying that we understand what this virus is, and we've understood what it was within the first 10 days of the first known case in China, which was reported on December 31st, 2019. Between that and January 7th, the virus had already been identified, which they compare this to June 1981, with the first case of AIDS was described, and it took more than 2 years to identify the virus. So it's interesting there. So it is in the same family as SARS. The disease is called COVID-19. It is thought to be related to the coronavirus from bats. So again, still a lot of unknowns. It is thought to be, and as I've researched this, is a lot of the information is we think, and it's a lot of not speculation, but unclear data. We know how to detect the virus. So since January 13th, a test to detect the virus has already become available. So, I mean, it's just a positive aspect compared to like how bad it could be if we had no idea what was going on and couldn't test it. And not saying that we've been perfect with the testing, but Davy Deals is here. Seems as though aside from attacking the detergents that leave your lungs passages open and inhibiting, also might have the ability to affect your body's blood and iron. Interesting. I like how much research Davy's done since I went off on him a little bit on Facebook. We're going to talk about that too. Davies wasn't that bad. It was a little misinformed, but it wasn't that bad. Some of the shit I had been reading. So that's number 2. Number 3 is the situation is improving in China. So this has come out in the last couple of days. Their cases have slowed dramatically. The last number I heard, I think, was yesterday or the day before. It's all starting to blend together. But they had 11 new cases for the entire country, so that's huge. So there is a tipping point. I guess the counter argument to that is even if it's going to subside and has a curve, the economic ramifications within the next 2 months could be huge, especially in the United States. So it's still good news, but there's still the perception that we need to talk about. So number 4, 8% of cases are mild. So this we'll get a little bit more into percentages that have been thrown around a lot in the last week specifically. No, I guess in this whole time, but the last week specifically. 81% of cases have no or mild symptoms, 14% have pneumonia, and 5% can be critical or even fatal. That does not mean 5% is the death rate. That's just saying that 5% of people usually end up on a ventilator, which, by the way, are in short supply in the United States because those supplies are coming from China, which we're not really getting it into, but that's a reality. 5 people are recovering. So in China, they're having, I think, like tens of thousands of people recover at this point. So that's good news. Symptoms appear mild in children. That is good news for children. The counter to that, and this is, I was reading on, I don't know if it was mumps, but it was another virus outbreak or another type of virus. It's not mumps, it's something else. But they're saying that there's some of these viruses where kids don't get affected at all, but kids are really good transmitters. So some of these viruses, like I guess like a COVID-19, but let's not compare it too much because, again, I'm not an expert. But some of these viruses, they don't even know that there's an outbreak in daycares until all the teachers and parents get sick because the kids have no idea they even have it, obviously, right? Number 7, the virus can be wiped clean. So it goes into, so you can go to this article, theconversation.com, 10 reasons why you ought not to panic. But what this is saying that at a higher alcohol content or hydrogen peroxide content in your cleaning solution, the virus can be completely wiped out with that cleaning solution being on the surface for 1 minute. So, but frequent hand washing with soap and water is still the most effective way to avoid the contagion. Science is on it globally. So, in a global effort, and it being, a long time since the 2003 SARS epidemic, we definitely have advances in technology. I'd also like to apologize to anyone I've talked to about the SARS epidemic and said that the Obama administration had it under control. That was Ebola I was thinking of. In 2003, Bush was president, right? Yeah, Bush was president. So SARS was in 2003, so I had no idea what I was talking about with that. That's why I said we got to be careful how we go about this podcast. So we're on number 9, but I'll go back to the comments to see if anyone. Hey, Pete. China shut down their last emergency hospital they made due to the virus outbreak. P, you're summing up the entire end of my podcast in one sentence. Easy now. They're already so number 9, they're already vaccine prototypes. The vaccine group of the University of Queensland in Australia has announced it's already working on a prototype using the technique called molecular clamp. And then it has a couple other vaccine prototype examples on here. Antivirals are on the way. So it goes through a series of these. These are broad spectrum antivirals that they use for Ebola and SARS and MERS. So they are testing those again and I guess tweaking them. It kind of goes on a while here. And then at the end of this, just as on like a positive note, the 1918 flu pandemic caused more than 25 million deaths in less than 25 weeks. Could something similar happen for now? Probably not. We have never been better prepared to fight a pandemic. I guess that means on a global scale. So that's from theconversation.com. So, well, bright news there. I'm going to take a breath for Pete here so he can pull clips out. It's okay, Pete. I'm just bugging you. Yeah. Any comments on that? So that is, I mean, it is somewhat positive, and I know it's easy to go to doom and gloom here right away, but that is definitely a positive outlook. If anyone has anything to add to that, let me know. All right, then. So the next thing I would like to talk about, and I told Marty I'm going to try not to get too riled up here. This is the world of gray. So I don't want people to panic. We're going to talk about the hysteria after as well. But here's my problem. This is the Ricky Gervais comment in his last comedy special. Social media gives everybody the opportunity to voice their opinion, like I'm doing right now. And I'm probably going to include myself in this. But not everybody should. And maybe I shouldn't. Maybe I shouldn't be out here giving my opinion on something that I'm not an expert in. But to the extreme, what I've seen a lot, and I know this sounds as lefty, far left liberal as possible, but I've literally deleted people off Facebook because of this, because I just don't need it in my feed, because it's just illogical. There's been a lot of people doing rants and putting some false information about comparing this virus to the flu, to like the common flu. It is coronavirus is the flu. But a lot of people have been comparing it to, well, actually 2 ways here. And so we'll go through both. Some people are comparing it to the Spanish flu, which is a tad extreme if you read through the articles, or it seems to be. But then some people are trying to compare it to the common flu. So there's an article here titled, and this is from wired.com. Also, I double checked this credibility. And it does come back as a fairly credible, as actually a really high factual website. So this article is a world of gray within itself. So it talks about the Spanish flu. Sorry, it talks about the numbers that have come out for the death rate for COVID-19, which is a really hard thing to nail down. The World Health Organization has been putting 2 to 3%. It actually got revised to 3.4%. But there's also some epidemiologists that have argued that the global case fatality rate I'm quoting the website, is closer to 1%. So we really don't know at this point. I'm trying to see what it says for comparing this to the Spanish flu. And I know like the difference between 1 to 3% doesn't seem like a lot, but globally, if like say 60% of people get this, that's quite a lot. And I've heard that number been thrown out, but I'm not saying that's an official number. Yeah, this website is really just talking about how comparing the two are really flawed. The Spanish flu infected 500 million people, nearly 1/3 of the world population at the time, and it killed between 50 and 100 million people, and it had a case fatality rate of 2.5%. This is not mathematically possible. Once the pandemic is over and all the numbers are tallied, its case fatality rate is simply the total number of deaths divided by the total number of record cases. Each country and the city will have its own case fatality rate, and it's also common to calculate a global average. If the Spanish flu infected 500 million people and killed 50 to 100 million people, the global death rate would be 10 to 20%. If the fatality rate was in fact 2.5%, and if 500 million people were affected, then the death toll would be 12 million. Interesting. So I guess this article is just saying even the Spanish flu numbers are off. So from what I'm reading, comparing this to Spanish flu, is that it's really hard to compare those two numbers. But let's talk about see if anyone has commented since. Hey, Leah's joined us. See, you needed me there. So that comparing it to the Spanish flu, I would, even with the numbers that are there, I'd be hesitant to actually be spouting off that comparison, even though it seems similar. That website is kind of like debunking some of the math. I think that also shows how hard it is for us to know what this fatality rate is. But even if you say it's 1%, if we go conservative, or like 1.5%, if we want to kind of somewhat split the difference, what people need to remember. So a lot of people are saying, oh, well, the flu killed more people last year. Sure, in a year. But this has been going on since what, January? In China, when it hit the States, I think it was February. Charlie, I'll get to your comment in a second. And I did see that podcast, and that's great. So when I first heard the compared percentages, it was actually in a press conference that President Trump was doing, where a doctor was in the audience. I don't know if Trump knew he was a doctor. I think he may have thought he was a reporter. But he asked Trump, like, are you aware that the flu has a death rate of 0.1%? And the death rate of the coronavirus at the time, they were saying, was anywhere from, I think, 1 to 3%. So even if it's 1%, a death rate of 0.1 compared to 1% is quite a bit different, right? This is where a lot of my frustration has been, is people that don't understand these numbers or haven't even seen these numbers, that are hearing something somewhere, maybe from President Trump, because originally he was comparing it to the flu. He even argued with the doctor in the press conference and said that the flu's higher than 0.1 and the corona could be less, which, to be fair, now that we have more information, Trump actually could be right with that, because even he said it should be closer to 1%. So he could be right. It could be closer to 1%. We actually don't know at this point. Could be closer to 3%. This is a reason why I wanted to do this podcast, is because we really just don't know. So a lot of us that aren't experts, like myself, I'm not saying I'm going around saying that these things are fact, but some people are. They're sick and comparing it, and they're getting mad. And I get it, because I was talking to a few people about this. I don't know if anyone remembers the Edgar Allan Poe poem, Telltale Heart. Most people read this and learned about it in school, but there's a part in the poem after the protagonist murders someone and they're feeling guilty about it, and they start hearing the beat, that when they're in bed hearing that, they start making excuses to what that sound is. And that's a psychological thing that we do when we are nervous about something. We will make up things that make us feel better, whether or not they're not true. So you add your confirmation bias to this, and if we're nervous about this and we don't want it to be as bad as it could be, we're going to start finding information and absorbing information that calms us down. So a lot of people are going to cling to these, oh, it's just like the flu and blah, blah, blah. Now, a lot of people will recover from this, and we're going to get into that. So this is not to panic people. This is to make people understand that it is a serious situation, and preparation is very important. And there's a difference between panicking and hysteria and just being prepared, which I think is a really important distinction to make in this really unique time. Just checked YouTube and there's no comments. So if you haven't done the research, please don't go on Facebook and start ranting about how everyone is overreacting. Some people are, but everyone's overreacting. We need to not worry about it and blah, 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 because this is still affecting people. All right. Don't mind the vacuum sounds in the back. So the next thing I want to talk about is just the global response to this. Some of this is going to be just purely opinion and things I've heard, and I'm not going to pull up necessary articles stuff. But this started in China. From what I've read, there's some evidence that some of the data was suppressed by the Chinese government because they thought they could contain it. And unlike Ebola, which was very much contained early, the containment on a global scale was not handled the way it should have been handled, and it did get away from us as a population. So that part of it, the containment, we can still try to contain it the best we can now, but it's definitely gotten away from us, and it's definitely here now, and it's definitely a reality, and it's going to be a reality for a while. And we have to navigate and prepare and try to slow the rate of outbreak. Rachel has a comment here, so we're going to talk about that. People comparing coronavirus to regular flu, Spanish flu. It's because we know that the Spanish flu, but we know about them. But the coronavirus is new and unknown, so people want to compare it to something they know. Totally true. And this is kind of what I'm talking about with kind of just natural responses. We definitely want to compare it. And I don't think it's a bad thing to compare it to the flu, but let's compare it to the flu with facts and the actual facts, and not just saying, oh, it's like the flu, and oh, last year the flu killed X amount of people. Well, this right now, the transmission rates are spreading and increasing in countries other than China, where it is slowing. So we can't compare it to the flu when it comes to death rates. So we don't even know the death rates yet. And it's only been 3 months. So we don't know where this is going to go. The flu, it comes every year. So we have data. We have historical data. So we need to stop comparing data when we don't have data. That's my issue. People are throwing people that aren't experts are throwing data and numbers out when we don't even have the right data and numbers to compare to. So everyone thinks is an expert because they have a social media. They have the ability to be on social media. So that's my only thing with why I was getting a little upset with comparing it. So the global response to this has been a little bit all over the place, and we're going to get into Trump a little bit as well, because there has been some major missteps when it comes to certain governments, and the U.S. government being one of them, when it comes to this virus. If anyone has something to add to just the global reaction, or not the global reaction, but the global health authorities, the action they have taken so far, please let me know. I'll give everyone a second here, because I'm going to go to Trump after this. All right. I know it takes a second to type, so I'm going to give everyone a second to type. One thing, if somebody wants to type something, I'll give you a minute. But one thing I would say is, just on local levels, I think there's been, especially in the United States, despite poor leadership from government, I think on local levels, the response has been incredible in a lot of places. I mean, I'm speaking a little bit anecdotally for my own organization, but I think the organizations in small communities that can and have been ahead of it a little bit have done a really good job with prevention, regardless of how people react to it, whether or not people think it's overkill or not. I think it's really important to be prepared, even over prepared if necessary, because at the end of the day, it's better that we look back and say we overreacted than to have this progress and get out of control and have us panic and then try to fix a problem after it's already happened, right? So I'd rather us be a little bit over-prepared and maybe a little bit silly at times than to be underprepared. Okay, so, and I know this is going to probably turn people away, but we're going to talk about Trump's response, because this is going to lead into my philosophical section later, because I think this is really important to show how much of a con artist, and I've said it for a very long time on this podcast that Donald Trump is the greatest con man of all time. And his ability to con a narrative is, see, I lost two people. I fucking called that. His ability to con a narrative is second to none. And this coronavirus is no different. However, this coronavirus is exposing that con a little bit more. Because when it comes to a health crisis, it's really hard to lie your way through science because he's going to get called out, and he has. So also, Trump got tested for coronavirus and came back negative. So that's good for him. Yeah, I did have an article that actually compared coronavirus to influenza, but I think we kind of went through all this. One thing I'll add to that, and poor Pete, he's not going to be able to make clips out of this because I'm all over the place. Sorry, I got a comment here. Hey, pal, greetings from Mexico City. I just back from Japan last October. Cool, right on. One thing that I will add, especially because people always compare this to SARS, this COVID-19 just has a higher asymptomatic transmission rate. So if you have even mild symptoms of this, it's really important that you stay home and take care of yourself, because even mild symptoms, you can transfer this disease. I had heard something, I didn't read about it, so careful with believing everything I say about this. But in the United States, there was a warehouse where somebody tested positive for COVID-19, and then they tested people with no symptoms, and there was a very high viral load in the swabs when these people that were asymptomatic were tested. So that just kind of shows that you can have no symptoms and still pass it on. So my biggest issue with the Trump handling of all of this is the dictatorship style of avoiding answering questions that should be answered. So a journalist's job, and they have done a shitty job of this in the like recently, right? Especially when you look at the Democratic debates, they've done a shitty job of holding politicians' feet to the fire. That's, in my opinion, that's the best wording for what a journalist needs to do in these controversial times, is hold a politician's feet to the fire, make them answer tough questions. And if you watch the Democratic debates, the Democratic presidential candidates were actually having to hold the reporters responsible for their shitty questioning, right? But then on the other flip side of this is there are some really good questions that Trump should be answering, and he is deflecting and denying these things. So I'm going to play two clips. There'll be audio because I don't have the ability for video here, and I'm going to have to turn the mic down so you guys don't get blasted here. If it's too loud or you can't hear it, one of the two, let me know and I will adjust. All right. This is clip number one.
Mr. President,
yes,
the
please,
last administration said that they had tested 1 million people at this point. You've been
Well, ask them
president
how
for
they did with the
3
swine
years.
flu. It was a
But
disaster.
with respect, you've been
Next,
president
please.
for 3 years.
Next,
and
please.
Wuhan was suffering.
They had a very big failure with swine flu. Very.
Okay. Fuck. So that was just a short clip. Any comments, let me know. I understand he's not prepared for these questions. And when it comes to politics, if he wants to say, oh, I don't really want to answer that, and that's not a relevant question, and move on, his base, and, even myself, is like, okay, well, he's being a bit of a dick, but whatever. He's just being a politician, and he doesn't want to answer that question. When it comes to a global pandemic, you should be able to answer any of these questions. Even in that case, ask them how they did about swine flu. Well, she's asking, hey, they tested 1 million people. Okay, yeah, they did this here, and this was their failures, and this is what we're doing, and we may have, not been prepared here, but this is what we're going to do in the future. Like, there's no reality where the leader of the most powerful country in the world should gloss over a question about a global pandemic. This is the reality that we live in. So that's one. And let me cue up the second one. So this is basically, I'm just trying to show how even though this is a very serious time, Trump is still using the same techniques he's used on like the campaign trail, and just like, other press conferences where he doesn't want to answer questions. So
My first question is, you said that you don't take responsibility, but you did disband the White House pandemic office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question
Hey,
because
Jay.
what we've done is, and Tony had said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know
We're
about
spending,
the,
no,
about
I
the
don't know.
reorganization that happened at the National
It's the
Security
administration. Perhaps they do that. People let people go. You used to be with a different newspaper than you are now. Things like that happen.
But this was
Okay,
an
please go ahead. We're doing a great job. Let me tell you, these professionals behind me and these great, incredible doctors and business people, the best in the world. And I can say that whether it's retailers or labs or anything you want to say, these are the best in the world. We're doing a great job. We have 40 people right now, 40. Compare that with other countries that have many, many times that amount. And one of the
okay, if I'm sure you noticed on that last couple seconds, this was a while ago. I think this was a week ago, or no, it's got to be more than a week ago. A couple weeks ago. I picked this clip specifically because it shows the incompetence that Trump has had when this first became an issue. Now, I could have picked a lot of different clips, and when they only had like one or two or whatever like that, or probably even before they had them, it got more serious for him the more cases that came in. Obviously, that's an obvious thing to say, and it should, but the angst in the preparation just shows how little he knew about this going in. And he cut the CDC budget. So that's what happens when you cut budgets to the pandemic preparation society or association services. And trying to deflect as the leader of the most powerful country in the world to then turn around and say, it's not my fault. I am a low-level, mid-level manager of a modest but successful organization. And guess what? No matter what happens, guess whose responsibility is in my center? Me. It's all on me. Doesn't matter who's in charge of what department. Something goes wrong at the end of the day. Guess who takes responsibility for it? Me. So this shows the lack of leadership ability that this guy has, and how much he's conned his way into this leadership, this position, this leader of the most powerful country in the world. So if that doesn't blow your mind a little bit, I don't know what will. The other things is that I'm not going to show audio clips for is just his silence when the stock market crashed. So the stock market had its worst crash since 89 or 85 or whatever, way worse than the 2008 crash because of this. And then the Fed dumped $1.5 trillion into the banking system to try to combat the stock market crash. So the stock market bounced back yesterday. And then silent Trump, who didn't talk about the crash, starts bragging about how this is the highest stock market rise in history. So now he's using it for political talking points because the general election is going to be in November. So mark my words, if this clears up, which I'm praying to God it does by November, that he's going to use all the positive points of it, like the stock market going back up, as talking points against Joe Biden when he gets into the general election. He'll just steamroll over Joe Biden, and Joe Biden will just be quiet because that's what Joe Biden does. So I hope that's not the case, but there's a million things we could talk about of how Trump has shit the bed when it comes to this. But you can just Google that or go on YouTube for 2 seconds. I don't have to go into that. So the other thing I want to talk about is the perception and the hysteria. So this is probably the biggest world of gray spot of this podcast. And we'll wrap it up pretty soon here because I know this is probably stressing people out. It's stressed me out quite a bit too. I think we need to meet in the middle here, and all of the ones out there that are trying to deny that this is a big deal need to understand that we need to treat it like a big deal, and we need to prepare ourselves with social distancing, with washing our hands, with cleaning surfaces. We need to do all of that while at the same time trying not to induce panic and going and buying all the toilet paper in the stores, or buying up all the soap. Remember, if you buy up all the soap, people aren't going to be able to clean their hands. We want people to have soap. We want everyone to have soap. Everyone should have soap. Don't hoard soap. I mean, don't hoard toilet paper either. The one other thing I would like to say to that is we need to be careful when we're talking about the ones that are taking this too far and being hyperbolic in their behavior and saying, oh, this is ridiculous and like stupid. But well, it's not necessarily ridiculous because it's a pandemic. It's a global pandemic. It's kind of a natural reaction, a natural human instinct reaction. So to say, oh, they're out to lunch. No, they're just acting off their natural survival instincts. I get it. I get why people are panicking. Does panic help this situation? Absolutely not. It's the same with just avoiding going anywhere all the time. Well, what if this, I mean, I understand there's the curb and we need to wait for this first life cycle. We need antivirals and we need vaccines, but there's a TED talk on the coronavirus. I forget what her name is. That wasn't going to be part of this, but she's saying it's here to stay. Just like the mumps, there's still mumps outbreaks, right? And mumps has a higher transmission rate, but mumps isn't gone. You're still going to have that in daycares, and there's still going to be outbreaks here and there. So there still will be outbreaks here and there. We just need to be responsible with our own hygiene, right? Wash your hands, don't touch your, especially now when we don't have the vaccines and antivirals. So I just really urge people to split the difference on where we're at right now. And this is why this podcast exists. And this is the world we live in. People are always going to go from one extreme to the other. And if you're nervous about it, find credible sources. I'm not that credible source. Find credible sources, get some information, keep yourself up to date at the World Health Organization, wash your hands, don't touch your face. So I think and that's really all you can do. All you can do is, limit going to large crowds of over 250 people. Maybe don't go to a concert. Maybe sports aren't the best idea where you're in close contact with people. That's up to people's own discretion. Really don't travel right now. I'm not even going to get into the travel aspect of that, but I've canceled Vegas. I was supposed to go to Vegas at the end of April. I've canceled Vegas while we figure this out, because at this point, we as the public need to do whatever we can not to make this worse, as our trusted health professionals do everything they can to create antivirals and to create vaccines, because we don't know everything about this virus. So these precautionary measures are very important, and we need to follow them calmly. We need to roll out protocol, and as new information comes in, we need to adapt, and we need to be pliable in these crazy times. Rachel has a comment here. He's 100% takes all the credit for the good things that have happened and zero responsibility for the bad. Yeah. And that's that one audio clip I showed. Yeah. He's saying he takes zero responsibility. At one point, he blamed the Obama administration, which if you look at the way Obama handled Ebola, the biggest thing was containment. I think I was getting Ebola confused with SARS before, not on this podcast, but when I talk to people. Go to Big West and thrash shows. I don't think this is an appropriate time to market things. I was literally just typing those exact words. It's a natural human response, not logical, not helpful. Yeah, 100% agree. And most of humans don't really work off their rational side. Most humans just go off emotion, both ways, whether they want to deny it or, run around like the world's on fire. And help your fellow humans out. Yeah, and I think compassion is empathy and compassion is a really important thing right now. We need to be careful because of social distancing and like not wanting to be around sick people. You need to be careful that we don't turn into this post-apocalyptic society where we are yelling at just turning on each other. Because these are these tension-filled times, it's really easy for an entire population to just turn on each other. So I think we really need to be careful with that. Marty was joking. No, I totally get it. I'm just trying to be careful right now is what I say. I totally get it, Marty. Okay, so Davey Deals has a comment. Also, so proud of you for doing some research. Doctors have some methods of treatment. Treatment that seems to work are, oh god, chloroquine, a cheap malarial drug. Interesting. Oh god, I can't even pronounce that other one. Plasma recovered patients and a steroid. Yeah, that would make sense because steroids usually like boost immune system. So yeah, his comment is just saying they are working on a lot of different treatments. Listen, at the end of the day, none of us should panic. We should be prepared. We should be careful. The other thing that I didn't even mention in here is there's like a 0.2% of cases of people under 20, I think it was. And most people recover, and most individuals that have not recovered have been much older. I'm not sure how many cases are like in the 40s. Most of these cases are 60 and up. So if you're younger, I mean, the biggest thing if you're younger is if you're having any of these symptoms at all is just not to go out and pass it on. So kind of staying in one room and one bathroom if you can. But I know these are a bit trying times. And at the end of the day, I want people to be careful, but at this point, go off the recommendations of your government, off the World Health Organization, still do things to keep your immune system up. So hiding at home and doing zero, even if you're going out and going for walks, just be careful that you don't tank your immune system by staying home and like drinking for the stress and eating a bunch of junk food and not doing any exercise, because it's really important that you keep your immune system healthy, right? But if you are going to go, somewhere where there's people either for your workouts or at the store, whatever it is, just make it, this is what that TED Talk was saying, make it routines. When you go into a building, wash your hands. If you are using, say, equipment at a gym, wipe that stuff down. When you before you use it and after you use it. Wash your hands when you leave a building. Wash your hands when you get home. Wipe often commonly used surfaces in your house quite often. I know this seems like common sense, but it's getting it into your mindset as a routine. And maybe even if you see people not following these things, having these discussions with your fellow man, because this is a time when we really all need to band together, because we're all just a bunch of people living in a society divided by black and white arguments. And it's really important in these times to band together and explore the world of gray. I'm Kelowna's Cougar Meat Kid Colin Cutler. Peace, love, wash your hands, stay safe out there.